across the country, hospitals are filling up with COVID patients. The Omicron wave sending caseloads sky high. According to the CDC, the current 7-day moving average of daily new cases is more than 660,000.
And with that spike in cases comes a dramatic rise in hospitalizations among children. The rate of new admissions rocketing past the previous peak in the summer.
And still, under 70% of eligible Americans have been fully vaccinated. The situation is especially concerning this morning in California, where the governor is calling in the National Guard to help. ABC's Zareen Shah is live in Los Angeles with the very latest. Zareen, good morning.
Hey, good morning, Whit. In the last week, we've seen a 72% jump in patients at hospitals here in California. That's according to the LA Times. And the situation is even more dire in other parts of the country, where they are now having to turn patients away. This morning, hospitals nearing their breaking point across the country. Over 80% of staffed ICU beds for adults now occupied. And cases exploding too. The U.S. reporting an average of over 614,000 cases daily, 6 times more than early last month. The number of COVID positive patients spiking in Southern California. Almost 44,000 new COVID cases reported on Friday in just LA County, breaking their record from the previous day. And pediatric hospitalizations are at their highest point in the pandemic. More than 5,000 children are currently in the hospital with confirmed or suspected cases of COVID. The spike shuttering classrooms. In Philadelphia, 46 schools shifting to virtual learning. In LA, schools are passing out at-home COVID tests. California Governor Gavin Newsom activating the National Guard to help expand testing. And officials still urging people to get vaccinated. But 26-year-old Winter Ho wasn't. She landed in the hospital for 7 months, finally released this weekend.
I developed pneumonia really quickly, and then from there my lungs collapsed. I couldn't breathe. This pandemic has been terrible and really sad. I have seen people pass away many times in the hospital.
In Wichita, Kansas, doctors are feeling the strain and saying they're just waiting for beds to open up.
If you don't have ventilators, if you don't have certain things, there are some things you just can't manage yet. It's a daily occurrence where we get multiple phone calls and we're unable to help.
And 40 hospitals in New York State now ordered to stop elective surgeries because of low patient capacity. This as CDC Director Rochelle Walensky comes under fire for confusion over her agency changing isolation and quarantine guidelines.
This is hard, and I am committed to continue to improve as we learn more about the science and to communicate that with all of you.
And here in California, the governor's office telling me he will propose $2.7 million in his budget tomorrow to expand testing and vaccinations. Eva.
Zareen Shah for us there. Thank you. And joining us now is Dr. Alok Patel, a specialist in hospital pediatrics at Stanford Children's Health. Dr. Patel, thanks so much for being with us this morning. I want to talk about your own personal experience. You were recently exposed to the virus and you've come down with some symptoms. Can you tell us about the whole process for you getting tested?
Well, good morning, Eva, and thank you for starting with that question in case anyone out there is wondering why that doctor sounds so nasally. But basically, I was not only exposed, I also had allergies, and it's hard for the average person to tease out, is this COVID or is this not? And I'm worried not about myself, because I'm fully vaccinated, about my unvaccinated 8-month-old baby. I've tested multiple days negative on a rapid antigen test, wanted to confirm with the PCR test, and I had to go through my doctor and wait over an hour in a line to get one. And this reality is not a luxury that everyone has. So what am I doing? I'm isolating, and I'm making sure that I have a well-fitting mask with good filtration, like my KN95.
I think so many people would assume because you're a doctor, it wouldn't be hard for you to get a test. What should someone who's not a doctor do in this situation?
I think the safest thing, Eva, is people out there have to just assume, unfortunately, that they possibly have Omicron. Take the necessary steps. If you can't get a test, see what you can do about trying to find a free one in your area. There are some free ones available in certain neighborhoods, and make absolute sure you have the highest protection of a mask around. N95, K95, KF94, or a surgical mask with a cloth mask over it. That's just the reality right now.
I've heard so many people say they're just exhausted of COVID. Do you have any sense of when we're likely to see this Omicron peak actually happen? Are we through the worst of it yet?
Well, the modeling suggests the peak in terms of case numbers would happen sometime around the middle to end of January. But Eva, that's just case numbers. We still have logging hospitalizations and all the indirect effects of the pandemic such as the mental health toll, which is going to last a lot longer. And there's still unknowns related from everything from such as other variants to long COVID. So fingers crossed that this is the worst of it, and we're going to see a brighter future after.
I want to switch gears here. The governor of West Virginia is asking the CDC and the FDA to allow his state to give a second booster to some at-risk groups. First, is this a good idea, and should we expect to see this in more states coming?
Well, I don't think it's a good idea to be talking about the potential for a fourth shot when we still have about 35% of eligible Americans actually going to get their booster. We need to be focusing on getting the primary vaccine covered and getting everyone out there a booster right now. There's just no data to really support that we're going to need a fourth booster right now. The possibility is there in the future, but we have to work on what we know works, and that's getting people fully vaccinated.
Dr. Patel, always good to chat with you.